So we're gonna go ahead and get started today in the interest of time, because Allison, who is here as our presenter from Unite Minnesota or Unite Us, is gonna be presenting and then jumping on an airplane to go off to a family function in another state. So she is here and she has her mother with her today, Sylvia, as well.
Sylvia.
My chauffeur.
Yeah.
How's the pineapple?
What? Remember he was on the phone with Bob and he was trying to cut the pineapple.
You still got your fingers? Good.
So I'll just start out real quickly. Ron Solheit, Executive Director of R3 here. We have a number of folks in the room. Go ahead, John.
Do you want to wait until
I think,
afterwards?
Yeah.
Go ahead.
yeah, we're gonna do a sign-up sheet, so we will get you everybody's name and email as this goes around, okay?
You want to start?
Yep, and then we'll try to grab the people off the chat as well, so that we have everyone involved. And Allison is here to talk to us about Unite Minnesota, and it's a coordinated care network of health and social service organizations. Partners in the network are connected through Unite Us shared technology. And she's given us a demonstration, and R3 has already signed up for this. Our folks, our volunteer navigators are already starting to get trained up and are going to be using this for referrals coming in, for making referrals and doing intakes to provide assistance to individuals re-entering from treatment to jail or prison. So I'm not gonna blather on too long. I'm gonna jump right into this with Allison presenting this software package that they use is just really pretty phenomenal, and it is absolutely free to nonprofit organizations. For-profit and government organizations have to pay to help support it, but hey, it's good for us and it's good
Amen.
for everyone. So, all right, we'll jump right into it, Allison.
Super excited to be here. I'm looking forward to meeting all of you. I don't have to race out, so I'm hoping to kind of get an idea of who's in the room right after, but yeah, I'm super excited to have this opportunity. So I met John and John introduced me to the work that R3 was doing. Met a couple of you that have been at some different meetings. I was at the meeting that was held at Goodwill, but just really excited to be walking this journey and seeing what we can do to build your reentry community of collaborators and find new connections to other supports that can help you too. So for those of you that are on the call, you're not gonna be able to really see me. I want you to see the group, but you guys can see the slideshow presentation. If you have questions, please just raise your hand when we get to that point. We'll try to call on anybody. Really want to make this conversational. I'm going to try to kind of go through the presentation pretty quick. I don't love death by power slide or the by slides. And so I want to give you a high level and then let's talk through about some of what it brings up for you when you're thinking about this. So really quickly, Unite Minnesota is an arm of Unite Us. So Unite Us is a national company founded by 2 veterans to help veterans figure out how to navigate the resources and the services that existed for them. When they did this about 10 years ago, and then when they got started, they didn't realize that they'd really stumbled on a solution that was needed by the whole population. So Unite Us is no longer military and veteran focused, but is really a solution, and we're working in 46 of 50 states. And the way that we do that is we sort of brand them by state. So Unite Minnesota just wants to really explain to you that I live here. I'm in your community and other people are in your community. I don't know which, oh, no, my Siri is talking to me.
Oh, okay.
I live there in the community and live here, and our team lives here. And so we're all over the United States. And in fact, little side story, we actually have a corporate headquarters in Minneapolis because we acquired a company called Carrot Health a year ago, and they had offices because they were headquartered out of Minneapolis. So we actually have offices up in the old schoolhouse building for the Minneapolis Public Schools up in the Northeast area. So it's kind of fun for us that we actually even have a headquarters here in Minneapolis. So again, we're part of a bigger company doing this. Figure out which buttons I'm using today. Okay. The goal is a new model of care that's driven by the community. So again, I'm in Minnesota. Our community in Minneapolis and St. Paul in the suburbs looks very different than rural Louisiana or rural Texas or New York City or you name it. So again, this is about us understanding what's happening in the community and really understanding where our communities need us to go and how they need us to build. this isn't supposed to be us coming in. I really even struggled sometimes when we first started marketing Unitas, and it was like, oh, we're here, we're saving the day. We're not saving the day. You all are saving the day. You all are the ones working with people. We are bringing you a tool to hopefully make your days easier, to hopefully make what you're trying to do better. So that's really, I want to make sure is important to talk about. Okay, so this slide's a little misrepresented because I'm actually gonna talk about 3 buckets, but what we say when we talk about this is health is not just clinical. 80% of health happens in the community. It's proven that only 20% happens in a clinical setting. So I was just talking to Bill, and Bill is saying how when he talks to different people, he's asking all these questions about everything going on in your life, because it's all of those things that are going to keep you healthy. And so Unitas understands that. So we sort of say that 20% clinical, when you mix it with the 80% social, that's when you have true health. But the reason I say I have 3 silos is because really this comes down to what's happening for care in the community, what's happening for care through government benefits and programs, and then what's happening through care, through healthcare and health insurance. So that's really now 3 buckets. It's not just health and social care. It's government care, benefits, healthcare, benefits, and then the social care, which is still that 80% and all of us trying to figure out how do we get people access to the things they need. So right now, when we're trying to do that, everybody's using different systems. Unitas is trying to bring everybody into a singular system. So to give you an idea, we're on some national standards boards trying to figure out how do we nationally standardize healthcare information so that it can be shared across platforms. I'm sure you hear about these things, HIEs, health information exchanges, all these different things happening, trying to make it so that all these different systems can actually talk to each other. Unitas is right at the table trying to build that kind of talking system. So what we're trying to do is we are really trying to get a place, a sandbox where everybody can play together. And that's what this tool does. Now, it does mean everybody choosing to get in the sandbox and play together, which is part of why I'm talking to all of you. But like, we're creating that space to hope that once we do that, we can really start to do things more efficiently and effectively. And I'll talk about that. So when we do this, we also want to talk about how we're putting a client at the center of their care. Right now, many times somebody's struggling and they get, here's a couple brochures, go call this place, maybe try them. And they're usually in crisis themselves, and it doesn't work. Yes, we can do warm handoffs. It still doesn't necessarily work. So what we like to also say is we're trying to create a client-informed, trauma-informed care system that really wraps those clients in those services. And I'm going to show you how that works and why it works differently and what it means for all of you. So the way that the system is set up, and Unitas has a couple different things that we're doing, but it starts really with what we call our Unitas technology platform. And it starts with the care coordination. So Tom is our example here, shows up. Let's say he shows up and he's talking to Bill with R3, and Bill's saying, okay, Tom, what do you need? And he's going through all of the things that Tom needs. Or he shows up at Glory Bound at one of their events, and he says, I'm here, super glad to be getting this, but I also am really struggling with this, and this, right? And we know organizations can't do everything for everybody. So whatever they can do, they do that, right? They take care of the things that they can do, but then they can gain consent and they can actually connect this person to the other things that they need through a secure platform. So it's HIPAA, FERPA, FIPS, we'll talk about privacy stuff, but it's a secure platform. They're sharing with consent someone's information, and they're saying, okay, I also need to get somebody here to help with childcare or diapers or food or whatever it is. And you're sending the information of the client to those other organizations that can help. And this is where it's different. Those organizations get an email, they receive that email, and they reach out to your client. And when they do, and they do the work for that client, you get the resolution. You get to find out what happened. And so it's not you having to track down to find out, did they not, right? When they make their updates, it updates. So it's sort of like everybody taking a piece of this care journey and then making sure that updates are being made along the way. All right. So it looks a little bit like this. Client gets created, right? Capture that consent. Make that referral, get them connected to some of the services that they need. The referral gets accepted. You know whether or not it gets accepted, or maybe it gets rejected. Maybe you send it to somebody who can't actually help them right now. You're going to know that too, but you're going to know, did they capture the ball? Did they not capture the ball? That group's going to do their service delivery, put their notes in, what was the outcome? And you're going to be able to see that. So there's this closed loop that occurs when we're all working together. So it's not just a referral anymore, it's that care coordination. All right, a few more slides and we're done. Talked about client privacy, it's a very important thing. So we take consent, it can be captured in 6 different ways. It can be captured by reading them an attestation, like, you know, if you sign up for new cell phone services, they're like, I'm going to read you something, and you say, yes, I agree to everything you just said. They're signing something on your behalf. Okay, that's user attestation. Otherwise, you can email it to them, they can send it back, you can text message it, they can send it back. They're in front of you, they can sign the form, you can take a paper form, you can upload it, lots of different options, but you have to capture consent. We do have specialized sensitivity restrictions around who can see what, because when you're doing this care coordination, you're basically attaching organizations who are working with somebody to a client journey, and you all have visibility onto that client. So it's creating an ability for you to communicate around a client. But certain times, let's say a food shelf has no need to know if somebody's involved in legal issues, right? There's certain things that are sensitivity restricted for client privacy. And again, if you know all the rules, HIPAA's health, FERPA's educational, FIPS is legal, 42 CFR Part 2, you guys are probably, most of you familiar with substance use. So like all of those systems, everything we're doing is in compliance with all of that. And then we're HITRUST certified, which is really kind of cool. The medical community has certifications to kind of ensure, right? All your client records, your healthcare records are all in really locked tight systems. HITRUST is the group that's testing and making sure that that's actually you're doing what you need to do when you're a healthcare. We hold ourselves to the same standards as the healthcare systems. One of the reasons we do that is because we're actually integrated with health record systems. So when the people hear the word Epic, which is a big, hospitals use Epic to take care of records, they can actually log in if the hospital is using Unitas, and they can actually send referrals to the shelf right from the doctor's office, the nurse's office, etc. So that's where we're moving with healthcare and health insurance companies sending referrals into the community. And then government being able to send referrals and have programs and understand outcomes. And then of course, to do all of that, we need the community. Okay, so an example, just to give you an idea, referrals come to you by all different types of places. You might have people walking in your doors for your programs, word of mouth for your programs. If you choose, you do not have to be receiving referrals, but you can get on Unitas with your programs and say, hey, we have these programs, people can send referrals to us. So you have lots of different ways where you're going to be having referrals coming in. That's just what the left side is kind of talking about. Again, your organization has probably specific programs that you want to stay in your lanes on. You have grants to fund, or you just want to stay in your lane, right? Do the work that you are best at doing. In this situation, that's rental mortgage and housing mediation. So they do that. But when they're doing that, they're talking to families and they're like, wow, you've got food needs, you've got utility payments, right? That could maybe help to relieve some money for the rent. You've got legal problems, you're getting evicted, right? All these kinds of things. How do we get you in touch with those things? So this is a real life example of Kentucky Housing, where they were able to show though, that after they did the things they did for their clients, they were also able at these high levels to resolve the needs for their clients in the community. And of course, those levels, I really love to see an updated screen, because this was when Unitas was just getting started in Kentucky. We would expect those levels to even rise more, right? As we get smarter, the system's only going to get more efficient and those numbers should go up. A lot of people wonder, what are we doing with all this data? So first of all, Unitas does not sell data. And then you'll see some of the people in this room have actually logged in. We aren't really even asking for personalized data. We use date of birth to keep people deduplicated. But then we need a way for them to get in touch with them, phone number and email, because when you make a referral, is the other organization getting in touch with them? We don't even require an address. We don't require social security numbers. Now, there's some organizations that there's fields for that, but there's some organizations that do use that, like healthcare is trying to map stuff back, like, so they're going to use other things. But we aren't looking to have data. What we're only looking to do is create the minimum amount of data that we need to be able to make that referral successful. But any data you do put into Unitas is yours to take out. So you can export all of your data, all of your notes, all of your information related to anything you put into Unitas. I've talked to a lot of groups that say we have to put a bunch of information into the government system here or there. We can't even pull that out. So Unitas isn't trying to do that. We're trying to make you have a tool that you can put data in, but then you can pull it out to make that storyline, or like Kentucky did. The other thing is once you've been into the network for 5 kind of interactions, we move you to what we call insights users. And you get an insight user. This is where it gets really interesting. A lot of our government partners, this is why they get involved, because they want the insights. They want to know what's happening in the community. And so they'll pay for these data dashboards. Again, not on a person name and what's happening, but on a demographic, like this demographic's looking for this, or we see spikes in this, or this is getting resolved, this isn't getting resolved. You can imagine the knowledge that can offer community leaders. So you actually also get access to that knowledge. Again, that's part of like, you're helping us build this, and we want you to be able to have the same knowledge that some of these big organizations have. And you can use that for grant writing, but you can use that to get insights into what's happening in your community. So we want you to have your data. Last slide. I really just want to explain that. So Unitas, I said, started with like a platform. The goal, right, is yes, let's get people connected, community, referrals, and coordinated care. So we start with that. We're helping communities predictively identify needs, and there's some ways that we can do that. We're helping healthcare predictively identify needs with the work that organization I talked about earlier, Carrot Health was doing. That was their bread and butter. So we're trying to get more predictive around when somebody comes to you, what should we be offering them? Okay, so that's one thing that we do. We help identify the needs, but then we're really just being a conduit to help you get access to people to get them enrolled in services, right? So again, we're not doing those services. We're also not serving the individuals. We're just a conduit, but we're hoping as we get that ball rolling, we're giving you that data, like I just showed you with the data insights reports, that's allowing you to measure what's working, what's not working. And then where we're headed, some of our new product lines is investing back in social care. So how do we move some of that healthcare spend that's going to be saved, hopefully, because we're going to have healthier communities, and reallocate that into social care. And so we have models where we're working, like, for example, with health insurance, where you have somebody who's, diabetic, right, and food insecure. They're going to have thousands and thousands of dollars of healthcare complications because of that. But if they can get them good, healthy food and reduce those complications, the ROI is there for the insurance company, and the insurance company is willing to pay for those healthy food boxes. So, like, how do we track that and get that money flowing back into the community? So that's called our payments tool. And so we're not modeling that in Minnesota yet, but we hope to be. What has to happen for a payments model to come in? We have to have a funder to come step forward and say, we're going to put money in and we're going to pay people out using Unitas, and then we're off to the races. So, so that's really like where we're trying to move health and social care into a new space. And again, it starts with the platform. It starts with the care coordination. The byproduct of that's the data. And then hopefully that data moves people to different decisions, different funding. And then we're trying to help to be that funding conduit as well. All right, I'm going to stop there on the death by PowerPoint. We're going to get some faces back up on the screen so people can see. And I'm happy to answer questions. Really quick before I say that, R3 is already on. The navigators are planning to use this, and GloryBound is our newest. They are not, their registration is in process, and so GloryBound is also already in process as well. So we're really excited to be here and hopefully build this community for you all to be effective together. Question?
Yeah, John Magnuson, thank you for your great presentation and the great work that you've been doing. When you talked about data, and that it's our data and utilization of that, do you have the ability that we can benchmark our data against other people's data so that we can get greater insight?
So I don't want to make sure I don't oversell, underdeliver. So yeah, when you're a paid Insights member, all that's possible for sure. When you're not a paid Insights member, and that's where, like, again, bigger groups can pay for more data. Right now, you're able to see the community as a whole and you're able to see yours. And so in theory, yeah, you could really say, this is what we're doing and this is what we see in the community. But it's more in resolutions, just like you're saying, these are the referrals we made, these are the resolutions, and I'm part of a bigger picture. One of the things we're very careful about are in all of our data sharing and even purchasing of data is we're not trying to create competition between organizations. If you can understand, like if you're saying, well, I'm here and I want to compare myself to, you know, who I see as my competitor, there's no way to do that because we don't want people using the data to undercut, right? So I don't know if I'm answering your question, but like there's a lot of opportunity to look at data and compare it to the big picture, but there's not necessarily opportunity to look at data and compare it to other organizations. And I'm happy to do a data demonstration. There's 7 different data tables and show you all the ways you can see data. And then you might be like, well, I want to see this. And I'll tell you, yeah, you can or can't based on these. Our data is broken down into 7 dashboards. 4 are focused on like understanding what's happening in the network, like what kind of organizations are covering the network, what referrals are sort of being made in the network, what's getting resolved in the network, sort of that piece. And the other ones are really focused on equity, where you can drive in and you can be like, well, how is that working for this community based on age, race, gender, and ethnicity? And that's really what those other 3 dashboards are around, is really on the equity side.
Just as a follow-up, and because you brought it up, in the presentation, you said you don't sell data, and then you just said for the paid data.
We don't sell personally identifiable data. So we are selling insights into communities and what people are needing, but we're not selling John, Susie, and Frank were this date of birth, this race, and they needed this. It would be John, Susie, and Frank and little bar graphs, like, and in that way. So yeah, we do sell. Yeah, so like somebody has to pay for all of this, right? And so that's one of the things that's, you know, I love being on the non-sales side because I'm not a salesperson. But health and government have the ROI, right? They have the return on investment. And so they buy that data to be able to make decisions with the hope that they're going to get an ROI. We know community care doesn't get to use that data. Maybe to do grants, that's an ROI for sure, but we don't want to sell to you. If some large nonprofits wanted to use it to be able to get more insights, then at some point in time, we're trying to recoup what we're building. And so there is an option to buy, but we don't really talk about that unless you're like, you just, and I'll be honest with you, like the data is not great until we get people using it, right? Like you have to have mass use too for the data. So I would never, my bosses aren't in the room, I would not encourage anybody to buy data right now because I wouldn't think that the data would be telling us, at least right now in Minnesota, we're at 225 organizations, but there's thousands of organizations and we aren't running thousands of people. So until we have a statistically significant population, my argument would be we would not want somebody buying our data because we don't now. North Carolina, whole different story. Government's all on, thousands of nonprofits, thousands of people being run through this. Now they've got statistically significant populations and their data is telling them stuff and a lot of stuff. It's some cool stories. We're just not there in Minnesota yet. But thank you, because that was a great question to clarify what I said. Yeah, Bob.
I am thrilled with what United Minnesota is doing. And I'm just gonna say, it's like a dream come true. Having worked at Prison Fellowship, worked with the homeless, now Glory Bound. I've always had this model of case management, a holistic view of the needs of the individual and their family. And how do we, like we work with families impacted by incarceration, addiction. And I'll give you an example. We've got somebody who's about to be evicted. And so working with United Minnesota, I got 3 resources to potentially help them with that issue. I also asked and found out that I can actually put in people that we currently have in our ministry, because we do an assessment every 6 months or so, that we can start tracking how well our current families are doing and have all that data there. It took me less than 15 minutes to sign up. And do whatever research you need, get an informed decision, but I strongly encourage you guys to get involved with this organization.
Thanks, Bob. I didn't even pay him to do that.
Well, and I think and it might be a little, because you're at the 40,000 foot level. When Allison actually goes through the actual online software program and so on, I mean, the light bulbs go on. It's like there are, like you said, 200 and some odd organizations currently in Minnesota on this network. Obviously, several more will be signing in, but what a resource it is to be able to just click on food, click on housing, click on, clothing, whatever the needs are, brings up the organizations. R3 is in there, just getting our feet wet with this, with the intent that it'll be a great resource for the folks that are doing the navigation, that to be able to sign people up, get them connected, send a referral out for services, and then be able to track the services that they received. Ultimately, in the long run, I think, as you said, the community becomes much healthier because of it. People are getting connected with those programs and services that they need, whether it's, just the basic human needs, or whether it's, medical, treatment, it's all going to be in there, and that just makes it that much easier.
So that makes me think of two things I want to make sure I say too is, so one, when you get on, I tell people, and I said this to Bob, right? I've told Bill this, tell me who you want me to go to work for. So like if you refer someone regularly to 3, 4, or 5 different organizations, give me that list. This is my job. I go out and build that for you and try to get them to come on. So there are opportunities, right, for me to go to work for you to try to build this community. That's why I'm here. If the reentry community linked arms and said, we're going to link arms and we're going to make sure our things that we need are all in here, like you're like a sub ecosystem. We don't need 2,000 organizations probably to serve the reentry community. Like we could probably get you 80-90% of the way. The other thing I will say is that on Unitas right now, even though we only have about 200 and some organizations, we have like a resource directory built of thousands of organizations. And so if anybody's familiar with NowPow, and that rings any bells, it was a CMS grant that brought NowPow to Minnesota. We purchased NowPow 2 last year, and they were already working in Minnesota. So they were building out resource directories. So we now have all of that as well in Minnesota. So if you logged in and you were looking at our directory, you would actually see thousands of organizations and information about thousands of organizations. What would only be possible is that bi-directional feedback of communication with only about 225 right now. But it doesn't mean that you're not going to be able to at least see a lot of what's happening in the community. And as you might refer somebody the old-fashioned way because you can't do it in network, right? Because they're not yet in. You can still refer them, learn about them, give them the information and log that in Unitas. And when you do that, I get an email and I know then I need to be reaching out to that organization because had they been on the network, then you would have been able to do that. And so then that kind of gives me my marching orders to try to help. So just want to make sure people understand there's a lot more data out there that can help, even though there's only 220 officially on. Another question, John?
I don't want to hog the time, so if anybody else has a question, go ahead. Go ahead.
My organization's in Washington headquarters. You guys in Washington?
Yeah, I took your information down and I meant to try to follow up because you were at the event at
Yeah.
Goodwill. Yes, we are everywhere, and you though are also kind of serving nationally, and so then.
I'm in every state.
And so what happens there is we would turn you on to our national partnerships team, and you can actually put your programs on and be seen across the entire nation. And so then you could be visible to every community where you could be serving. Now, that could intimidate you. You maybe don't want to go straight in all across the nation, but you can go in at waves and things. So we have a national team that sort of onboards national organizations. And so we can try to get you started on that conversation, or I can get you in touch with the Washington team, start in Washington, and then work your way to other networks.
So I did go online and asked to be a member, but I didn't hear back.
Well, that makes me very sad.
Gotcha. Should we have that meeting?
let's chat. Let me give you my card. Let's make sure we chat. And let me make sure I get you the card.
And just so everyone that's online is aware, we do have the chat open, so if you want to ask questions or, you can unmute and ask a question. I put Allison's contact information up on in the chat as well, so you've got her email and her phone number. But keep in mind, she's gonna be on vacation for a little while.
I'm just
for a few days, the weekend.
The weekend wedding.
Okay,
I did just put in the chat though, that's my meeting link. And so really one of the best ways to get me, if you just want to sit down, you want to go into a demo, you want to learn more one-on-one, is to just click my link, find time that fits for you on my schedule, and you're booking yourself into my calendar.
and the demo is really, really eye-opening.
Oh,
as far
yes.
as- Yeah.
Yeah, John.
Do you have, built into it a billing function?
So that's sort of what payments is, right? It's like somebody comes to you, they get a service, and you're basically invoicing the organization that said they'd be a funder. So not without a funder, but like if there's a funder who said, yeah, we want to fund and we want to do payments through the system, that's really what you're creating when you do the service. You're basically invoicing them to be paid for the service that you just rendered.
And is your platform pliable where I can have somebody build off of it to customize it?
No. So the one thing about Unitas is because of the security parameters, we really don't have anything so we will do single sign-on to make it easier, right? We can do some of those kinds of things, but we don't really have the ability to allow data to be, you can extract all of your data in CSV and load it anywhere you want. But we don't really have any bridges in and out, except for Epic and then maybe a few interoperables that we're working on. We have an integration with Salesforce, but it's typically only with like large Salesforce. So we're working toward that, but that is less of a priority and if it's not on the healthcare side, the social care side is gonna be lagging.
And then the last one that I have, so give others, on your, you do the great connections. But for the case management, do you have an ability, what's your build out of the management's case management? For being able to build back to payers.
You still have the screen, right?
I'm gonna show the screen in a minute. So the case management, anybody can, and so I'm gonna take us in, just for a second, just to give you a quick, I will make this really quick. I'm gonna actually navigate I'm gonna have to sit for a second.
We did have one question too on
Okay.
the chat about providers by location, so I don't know if you can get to that.
I can show that on here
Yeah,
too.
okay.
Okay, so this is the Unitas dashboard. This is all made up right here. This is not anything real, made up organizations, made up everything. So don't worry, I'm not sharing anything about anybody. Okay, so what you were just asking, increase coordination. Thank you. Thanks, Mom. My brain was like, wait, what else are you just asking? Okay, so when you're in a person, this is what we call a face sheet. So I'm, for example, in Samantha Bergen's face sheet, you can see we have consent. We wouldn't have been able to actually do anything with Samantha had we not gotten that consent. You can see how you would refer Samantha. You can see how you can make a note to like go back and remind you about Samantha. This is really where if somebody's serving as a case coordinator, anybody can assign themselves as to the care team. This is your chance to be able to, everybody that you're going to be able to see, everybody that's working with. So if Samantha's in the system, you can look at her referrals and you can see right now, she's was sent out from us to Young Life Outdoors. But that's how you can see who's working with her. Let me pick somebody who I've sent 1,000 places. Again, fictitiously 1,000 places. Here's Randy Anderson. Randy Anderson's been sent out for a lot of stuff. And you can see like if they've been accepted and then their statuses. So that's kind of how you would see that. But like, if you were like, well, I really want to know what's going on with Gatsby employment. What's super cool is in the first quarter of this year, we're going to be implementing where you can actually be talking to who they're working with at Gatsby employment right on here. So we're actually going to have ability for you to like be able to communicate in platform with questions. But like, say somebody's working with them and they are the social worker or the case coordinator, they would add themselves to the care team. I sort of see navigators as R3, probably wanting to put themselves on as sort of that care coordinator, right? They're navigating them to lots of different things. So not requiring people to do that, but that's sort of a way to say like, hey, I'm working on all this and I want to kind of be in the know. And so you can write that there.
So does it have then somebody who would be, you know, if you have like, let's use football, you just had the Super Bowl. You have a team, but you have 10 quarterbacks, the team doesn't work so well. You have like a primary
Nope, you just,
coach or
you,
primary person?
you would just keep adding and the relationship would be here, right? So you kind of be able to tell, like, I'm the quarterback, I'm the linebacker, right? The relationship to the team would be known, you know, so it's as easy as if you wanted to be added as the care team, you just say like, so I'll just say, I'm gonna add myself, I'll say I'm Ally, person, or we'll say Preston. Okay, and then I'm the relationship is I am the social worker. You know, and then if I wanted to put my email on here, because again, it doesn't have to be, and this will actually become where it's going to be really cool to be able to communicate right directly, phone number, address, anything I want to put. This care coordinator could be the mother, the guardian. I mean, it doesn't have to be somebody on Unitas. That's why the address and email is there. Like it could be a place for you to note that. Now we just added this functionality, but family members can be noted, right? And that can be important to understanding like how the family makeup is. So this whole face sheet, if the client's willing to take messages, you can email them from here. You can SMS text message them from here if they've given you that permission when you set them up. So you really have the ability to make notes, keep notes as a team. You can, you know, if you add anything here, and we do encourage you to be careful about adding personal health information, because this is everybody who's serving this person is going to be able to see these notes. Unless when you add your note, you want it to be kept internal to your organization, then you can actually click. Why am I not clicking on that? You can actually click to make it, why am I not clicking? Oh, it's because I have too many screens. I'm clicking on this. Sorry, I was clicking on a Zoom functionality. So when you add, you can go ahead and write the note and you can say private to my organization. And so then that's a way of keeping notes that are just yours or keeping notes that are holistic. So you can see how you can kind of be care coordinating by just making sure you're adding the right information here. The question that came in on the platform or on the online was around networks and be able to see the networks. Right?
To be able to see the networks that are currently on, like say Minnesota, you said there are about 200.
So until you're a member, you can't really log in and see everything. And honestly, I can't even log in and see it because of security reasons. We don't even have a login to see our real network. But if you're on the network, you would then click in network and you'd be able to see all the dots for everything. And again, these are all made up, or out of network, and you'd be able to see all the dots of anything. And then you can go into any organization that's in here and you can get information about who they are, if they are in network, the programs that they are listing, eligibility requirements, etc. And so all of that is at your fingertips under the My Networks tab. A little quick other walk around. I mentioned you can export. It's as easy as creating a new export. You tell what ranges, what dates, what you want. It downloads it, you get an email, and you drop it in as a CSV. I kind of talked about the clients tab. These are all clients. If you want to search them by clients that you've marked requiring action, you can do that. If you don't want to see all of them, you just want to see the ones that you're connected to, you can pick your name, etc. So if you've got a big organization, the dashboard can be a little overwhelming, but the thing to think is if your organization, not all organizations have to send and receive referrals. You can be a sending only organization and just use it to send people out. Like R3 right now is set up as a sending only. So the navigators can send people out. We're not necessarily taking referrals in to become part of R3. So they would never see an inbound referral, right? It's not even going to be a part of their platform because they're not set up that way.
But if anybody wants to volunteer in that capacity, you can accept that.
Well, and our intent was to get our toe in the water before we jump in up to our neck, because the concern was we're just getting started, getting our navigators are learning the software. And that just, you know, if all of a sudden you get 30 referrals or intakes, it makes it a little challenging. But we're gonna, there was another nice feature that Allison had pointed out is you can create an application. So if you want to put together an application that can actually be sent to somebody. They can fill in the information, send it to you, and then you've got it all right there. You don't have to do a one-on-one, face-to-face interview or back and forth on the phone. It's actually a really kind of a neat way that we were thinking. As example, case managers in the prison would have this, could put it in front of the client, they could enter that data. At least on that form, and then ship it to R3, and then we could do an intake, and it would just simplify things.
So this is how,
Transition teams in prisons will.
this is how it would look. You'd brand it with your organization's name and it's a form. And this is the same information you need to create a client and asks for that consent. And they sign it and it basically goes straight into Unitas. And then you would have an inbound and it would come under a category called assistance request, not an inbound referral. It'd be assistance request, which would tell you that it came from your website. And it would be, then all that data entry for clients is already done versus what you have to do if you don't have it that way is you actually have to go in and create your client when you go to make a new referral and start like with creating their profile. Yeah, John.
Do you have, and again, I don't want to hog the time.
You're asking good
You're
questions,
yeah,
that's why.
Everybody's hearing the answer.
So if there is, the ability to make referrals, is there a way that we're then categorizing people? And how do I know, like, if somebody says trauma-informed care, how do I know that they actually practice trauma-informed care rather than they just create as a word? And so with that, is there some kind of a screen? Because I'm gonna refer people somewhere, I wanna kind of know that the person I'm working with is.
Well, also, if they accept the referral, you'll get notification and you get notified something about it. So
Yeah, so we, first of all, we're getting to know you pretty good when you go through this process. And so we have turned organizations away that maybe are discriminatory. So we're trying to make sure that we are making sure the organizations on there are going to be the right kind of organizations. But one of the ways that you can really narrow in on organizations who are going to probably be generous to your clients is your population specialized in serving. So if you're working like, let's say, the Justice Evolved. By the way, Adult and Teen Challenge is also on the platform. Just noticed your Adult and Teen Challenge jacket. So,
Yeah, Micah.
Sorry, I gotta head out. I have to get on the St. Cloud prison. Gotta go to transition.
just make sure they let you out at night.
Pretty awesome. Dan Sheppy says he's sorry he couldn't be here. He wanted to connect with some people. He might try to stop by. Courtney's gonna handle our kind of update
Who
for
was the individual you just mentioned?
Dan Sheppy.
What's his?
He's a director of outreach. So.
that's who I work with, is Dan and Alan. So, yeah, but yeah,
fan
so,
over.
yeah. Yeah.
Thanks, Micah. Good to
Great.
see you again.
Right there. Amen.
So like, for example, like, right, so like that example, like if you're working with somebody who has substance, use, or again, justice involved, these are opportunities to narrow your search criteria based on groups that have self-identified that is a population that they want to serve or prioritize in serving. So as people fill out and Bob can speak to this, R3 can speak to this, when you fill out what you have, you basically tell us, right? Is this catering towards a certain population? If yes, who? If no, that's fine, right? Some programs don't, but you're telling about restrictions, what kinds of restrictions, all of that gets built in so that when you are in here and you're referring somebody, if you really don't have a clue who this organization is, right? You can, first of all, look into the organization, see the information, see what they say. You can go to their website, right? You can see their restrictions, the populations they cater to, their languages, their accessibility. All of that information is right here at your fingertips. For the in-network organizations, there's a lot of information because it's the information they provided to us to become on the platform. For the ones that are still out of network, where we know enough about them, it's more of a general shell of, maybe they're about us from their website and just basically their basic information about their organization.
I think getting to that though too, John, is when you either in network or out of network, when you pull up the information, it really is incumbent on, the referring entity
Right.
to at least know where you're sending them,
Yeah.
contact contact the organization or have some history with them. I think that's what we're looking for too, is to be able to do that.
Do you on that list also get into the granular of like bed capacity or, you know, availability of service, you know, waiting lists, that kind of thing?
So there is a way to do that. So if I'm an organization, so I'm logged in as an org admin, so this has got a little building up here in the right-hand corner by my name. And so if I am an organization and I have capacity tonight, I could have shelter open, right? Say the organization hits capacity that day, what they could do is they can go in, and this is gonna be a good example because I'm on student services, but they can go in and find their program that's shelter. They can edit it and they can immediately turn the program off because they're at capacity and hit save, and immediately that program is off. So if you got a community to really do this, right, and you were really working together on this, you could be saying, refer to United, if you see our program's available, it's available. And we'll get the referral. It immediately sends you an email and you could be finding out who it is, getting in touch with them. I mean, it really could be very, very live.
So
It
my
with the
bed-
commitment that they would be updating that
Yeah.
Yeah.
of availability, but
So-
it's that easy on
So
and
if
off.
my beds were full and I click.
Yep.
I'm now not though visible to the community that I serve bed.
For
because
that
now I
program.
don't have any.
For that program, you're not gonna show up until your beds are available again.
Is there a way that you all can build it that I can show the world that I have beds that are available? I just don't have them that day because as I'm going through and looking at the search, if I see that Teen Challenge doesn't have any beds available, well, then I think, oh, well, they don't have beds.
So the way you would do that is you are not, when you do housing, for example, there's all kinds of assisted living, emergency housing, you know, housing applications, housing mediation, permanent housing, transitional housing, drop-in services, housing case management. I would say your housing case management, maybe that's like the umbrella that you have and that's always on, right? But your housing for shelter that night, which is your
So you
emergency,
got your general services that are always on, but then you're.
you're turning off
Okay.
that subsector. So there's 180, I think it's 40 major sectors to 180 subsectors. So you can get very nuanced. So it would just be really, again, being intentional, saying, I don't want to not show up, but I want to not show up under emergency housing tonight.
And then turn it back
Thank
on when the
Okay,
bed
yep.
becomes available. So
Honestly, that's just a relational thing that a person would know that worked in the industry. There's not a practical way to get out there and say vacancy, no vacancy.
So there is.
But I'm
you
gonna
just
have
to
it
have
tomorrow,
somebody
I know,
cool that
but I'm
does
gonna have it tomorrow. That's a thing that you know, like, for example, when you work with an position, there might not be a bed today, but there will be tomorrow because it's a wheel that goes around.
Yeah.
Right, but we should be able to get to, if we're all on a platform, to where I can just go in and I can know right now where every bed is that's available in the state. Illinois has a system that.
it's only provided somebody's inputting that data on a
Exactly.
daily
Yeah.
basis.
Agree. If
Oh,
we're all going on to a system, then we need to be able to have the capability for that, because
And that's that.
Illinois has, and they use Epic and whoever their provider is that they're using, where you can literally go on and track every person that's in the entire system and know how many availability of everything there is. Just like that, so that when I'm looking to
Yeah.
place, we get into that I don't have long waits. I got like, right now I can get. And I bet you can do it, if not today, over time.
Right, and I think, you know, that's like, we're always making improvements, you know, wait lists are things that are, you know, people are talking about, and so Unitas is always kind of pushing the envelope. I mean, like I said, we have new things all the time. It's Christmas every time we have a meeting, and so there are going to be opportunities for those things, but where a lot of what you're talking about comes into play is that's what these meetings are for, right? Okay, so we're going to really try this next month to do this, and we are going to go on and off with our programs, and you should be able to find it that way. And people really starting to get a strategy around how do we co-share services for our community and be really strategic. That doesn't happen in a vacuum. So I can give you a tool, and that's where I say it's all of you. Like having a group that's meeting like this and saying we want to do it better together. it's a great place for me to bring a tool because I can give you a tool to do it better together. But it still has to be an intentionality around the team and the strategy and the pathways. And that's something that we're really trying to help see how we can facilitate that with Unite Us, because that's community leadership that we want to lift up groups like R3, because you're doing that community collaborative work that we're supporting. We can't be both. We can't be leading these meetings and supporting it. It just doesn't work.
I strongly encourage anybody that has questions, sign up for half an hour, 45 minutes with Allison, do a Zoom meeting, and she can, go through the database, she can answer all your questions. I mean, I hope everybody's interested enough to at least either sign up or set a meeting with her.
But Bill, question?
In Hennepin County, the county has chosen to be the coordinator for all emergency and transitional housing that has government, state funding in it. So that's their key, and they have, the individual looking for it shows up in the basement of the St. Paul Church. And sometime after
14 days, they get an intake
try
and
to
an
get-
assessment.
and try to get a voucher for housing that night. And it is, if you come there probably by 10 o'clock, you're all gone.
So one of the things, because HMIS isn't going anywhere, and we know that, and getting on those lists and prioritization and the rules and HUD-VASH and all that stuff's not going anywhere. One of the strategies that I'm really trying to look at is how do we get to the assessors? And I've been trying to do some research, and it shouldn't be this hard, but it is. You can't find a list of every assessor in the state of Minnesota anywhere. I've even called the people who run the system that everybody's putting the data in, and nobody can tell me who's all the approved assessors. But if you could get a list of all the assessors, and the way to get it is go county by county and find it on their website. And I've now figured out who in Hennepin County is the person to try to get there. But my goal is to try to get all the assessors on for housing. Because if you can get somebody to an assessment, then you can kind of in your mind say, okay, that ball's been handed, they've gotten an assessment, and they're in the queue. Right? That is all of that longer term supportive housing queue that is happening. If we could figure out the assessment piece, we could get people into that queue. Then the emergency shelters piece, I think you can still have this more active relationship with some of the groups where it's, maybe like we have places we don't, but there is now in some places in our country, HMIS has decided to work with Unite Us, and they're doing it together. But that's, I think, going to be a harder nut to crack. I'm just gonna be quite honest in Hennepin County. Quite honest.
Well, and I think, I think, even just thinking about through, like you're asking about capacity, and even just adding a wait list button so that, we've got beds. It's in our description how many we have, but if there is just a wait list line that says, well, we've got beds, but we don't have them right now. Would be a simple solution. I think back to years ago when the juvenile detention centers and residential centers trying to keep track of where were their beds available around the state. And you know what the Department of Corrections solution was? They hired a life sentenced inmate at Lino Lakes to call all of those facilities each day to find out if they had capacity. And then there was a hotline that you could call in and find out where is there a bed available. This seems like a much better solution. Just saying.
Yes.
In 2023, all new arrivals do have a comprehensive assessment plan shortly after their arrival. If they haven't had it before they arrive, they get one within 3 days. And we're using one of the presenters that's been here before that.
Good. I mean, whole health.
Yeah.
So.
Yeah.
All right, I don't want to take up your whole meeting. You
No,
guys might have other,
you are the meeting.
well, but I don't know, and lunch is here, so you don't want to be standing in between that too. So anyone with questions, I have cards, I can pass these down and around. If there's somebody, you're not on Unite Us right now, and there's somebody that you come across that needs help, feel free to grab these. When we were talking about a way to self-refer, like sort of they can self-refer on your website, I showed you that. This is sort of a statewide self-referral code. So we handed one of these to somebody standing on the side of the $5 bill. We handed them this, and we gave them a card. And the hope is they will find us, they'll fill it out, tell us what they need, and then we will start sending those services their direction. So this is sort of being maintained by a team Essentially, we don't like to advertise this because this isn't how we want it to happen. We want it to happen between orgs.
Yeah.
We don't necessarily want people to come in this way, but we also just want to get people help. So feel free to take those as well. And then I am happy to meet the people on the chat. You got my meeting link.
We put that in plus your email and
So
the
you
other
have
thing I
everything.
would say is it's really important because I found out as I was going through the registration process was make sure that you detail the services that you actually provide. You know, we refer people with the navigators, we refer them for housing, we refer them for, so we don't provide that service. So when you're clicking and fill the box, we don't do that. We do, you know, case management is basically the service we're providing, not the actual, you know, somebody's looking for clothing or furniture. Yeah, and you want to be sure that that's kept real clean because then they get to the right organization to get that.
And just so you know, I think it's a great product. I just asked critical questions.
Oh, I'm not, trust me, you guys are not critical at all. This has been a very welcoming group to present to. I can share critical. There's been critical. I had a colleague actually just share that he was in a meeting and the HMIS guy got up at the end. This was in another state. In fact, I can't think of where my colleague's at, Gregory. And he said the guy stood up at the end of the meeting and he's like, we're never working with that on HMIS. So none of you in the room that think that this is going to happen with HMIS, fall for this. And he walked out.
Whoa.
And it was 50, there were 50 people in the room. And my colleague was just like, okay. And then it was like, and that's really where we want to have that conversation. Like we are not HMIS and we don't plan to be HMIS, but something there is telling this guy that we're trying to be HMIS. And it's like, no one's going to replace HMIS. It's a government system. It has to be done that way. They don't get their money if it's not done that way. But like, we want to create the bridge right up to the door of HMIS, and people who are using HMIS, if they're doing care coordination, you can't do that on HMIS. You need a supplemental tool. And so we're either the supplemental tool for HMIS, or we want to get them right up to the door so that then they can get them in through the assessors, right? Into HMIS, so HMIS can do its job. So, but that's like, yeah, all things have happened. But yeah,
So I see there was one more in the chat. Lorraine was talking about rural work and working with Prime West in
And
many counties.
I wrote that to her. I
Okay,
said that
you
I'd
did.
love
Oh,
to talk
okay.
to her about the rural work and that we're working with
Okay.
Prime West.
Okay,
Just quick thought here, could you give your 30-second elevator speech on what Unite Us is? Just to help me conceptualize some of the key components, so I can even use that in explaining this to others.
We are a care coordination tool to bridge between health, government, and social care, so that people can get navigated to all of the services they need in the most efficient and effective way.
it's absolutely a tool, and the nice thing is it does give you feedback that they
Yeah.
actually received the
Yeah.
service.
Closed loop.
Yeah, closed loop tool.
Yeah, question.
So this word government keeps coming up over and over and over again. I've been sitting here trying to ask this question. What do you do with government? Do you do referrals to state and county organizations? Do they have RFIs available?
So Carver County is on the United platform. Super excited about that. That happens to be the county I live in, and was the work that I've been doing with a convener out that way. We have some Prime West is the healthcare provider for about 22-ish rural counties across Minnesota. Prime West has purchased us to be able to do healthcare with counties, and we're working on that in the more rural environments. Lorraine, that was my answer. She put that in the box. So yes, we are working with county governments. We are in conversations, probably not supposed to tell us, but just hushes the word, with IT and DHS. They are very interested, and those conversations have been going very well. We are speaking with the governor's chief of staff and team, and we're trying to get built into the 2023 budget for the governor. So like, those conversations just don't move fast. We've tried to crack into some of the corrections conversations based off the meeting. When I first learned about all of you was actually at a corrections conversation, I think that I had dropped into. And so like, you know, we don't know where that's gonna go. It's just, it takes time and it takes a vision of leadership, you know, in the right spots, at the right places, at the right times to do that. But yeah, in some states, absolutely, government means government programs and government even doing payments through our systems and everything like that. Yeah. So the potential is there to be fully integrated, but government does have to buy in because that's how we pay to make it free for everybody else and continue to keep our work rolling. So government and healthcare. In Minnesota, I think I'm allowed to say this now, we work with United Healthcare, UCare is a newer one, Gillette, Alina, and Health Fairview, all in the Twin Cities. So and so some of those things were from our NowPow acquisition that are being transferred over into because we took the best of NowPow, we took the best of Unitas, we've sort of been bridging them, and eventually they have to come on to Unitas because we're not keeping the NowPow structure. And so we're in the process of all of those conversations. You know, so there's just like, the sky's the limit. One of our biggest healthcare partners over the years, kind of the early adopters, was Kaiser Permanente across California and Colorado and some of those groups. So I mean, we're working with the biggest players in the industry on healthcare. And yeah, I mean, it's just a long game.
When you say healthcare, is mental health care involved in that? I mean, just because they're an HMO or a big, you know, is
Yes.
that a big part of it?
So on the platform right now, if you're familiar with Lee Carlson Centers, Lee Carlson's on the platform, so they're receiving referrals and they do some really cool drop-in immediate availability. They do a really good job with their scheduling. So for mental health, we have some other private practices providers. Mental health, one of our big ones though is, oh gosh, Knutson.
Nystrom's or?
Nystrom's not on, but Knut. So I have I say it this way. I have a colleague who does the same job as I do, but she is on the state council for mental health, like the governor's council for mental health. And so she's kind of in charge of our mental health work. If you wanted to know more specifically about what we're trying to do on the mental health side, Angie's really the one to talk about how we're getting those conversations. The one thing that makes mental health a little bit difficult, and I'm just super transparent on this, is that if they're getting healthcare bill backs, then there's an ROI to being on, and Unitas is still trying to figure out how to sell to small providers. And yet if they're nonprofits, right, we say we work with all the nonprofits at no cost, but we're just still trying to figure out how to, somebody has to help us to keep building this thing. So we're trying to figure out where is it fair to charge and where, and then you can imagine contracting with really small groups when you're trying to scale like we are isn't our priority. And so there's sort of this middle ground that we're all asking, like, how do we do this faster in this middle ground with some of these groups that are maybe billable services and maybe should be paying for licenses, but you know, they're not getting an ROI and we don't want to contract with small. And so how do we do that? And so we're kind of we're figuring that out.
I don't know that you mentioned it, but just to be clear, at the HIPAA, you're protected, you have compliance with what, 3?
HIPAA, FERPA, FIPS, 42 CFR, all the compliances we are compliant with.
There you go.
Even there's a thing called VAWA, which is the domestic violence stuff.
Mhm.
And when we can't be certified by them because we don't provide services, and that's what their certification is, but we worked with the DOJ, made sure that so to be able to navigate domestic violence survivors through our platform, that we're doing all the right security parameters for them as well. So a lot of compliance. So